Hi, welcome to today's flash interview sponsored by ACO Exhibit Hall. My name is Glenn Pearson. I'm the author of the book called Thriving in the Healthcare Market, Strategies from an Industry Insider for Selling Your Product. And today we're talking with a company called HealthEC that specializes in population health management. This is actually the second time we've had a chance to speak with them. I interviewed their CEO back earlier in the fall. But today, I'd like you to meet Dr. Jennifer Yeager, who's their Senior Medical Director, and we're going to talk specifically about the issue of social determinants of health. So, Dr. Yeager, welcome to the interview.
Thank you for having me.
And I just want to ask you one question. What are the top social determinant of healthcare needs that ACOs have, and how can HealthEC help your clients with those issues?
Great, thank you. The top issues from a social determinant standpoint would be housing instability, food insecurity, transportation, and there I would include access to medications, access to healthcare, and I would include social support, brought more to the forefront now with COVID pandemic and social isolation. And within that, you could include issues of mental health and depression, as well as personal violence. I think that those things, once you have all of that taken care of, the rest is a breeze.
Is that all right?
In terms of how can HealthEC help, as a care management program, as risk stratification, from the standpoint of how does technology improve and quite frankly directly improve health outcomes, we focus on connectivity with community partners inside the healthcare system at all levels, from care coordinator to provider to administrator, as well as I mentioned, external partners, community partners who are sort of boots on the ground helping to address these issues. The second would be care management. So SDOH brings to the picture more from a prevention and wellness rather than sick care. And so identifying with risk stratification who is at greatest risk for the long-term consequences of poor health care, and again, the impact of SDOH, as well as taking a look at risk stratification, risk mitigation. So from a CMS and value-based contracting, being able to track total cost of care, quality, and performance in terms of helping your patients toward better health. And we can sort of help at each of those levels.
So it sounds like really you're a hub to allow connectivity, transfer of data, getting to the right people at the right time who can help intervene and try to mitigate the issues before they get worse. Is that right?
That's it. Nicely summarized.
Well, there you go. Thank you. I do listen. So, thank you for your time today. And let me refer the listeners to the webpage at ACO Exhibit Hall. There's a great looking booth for HealthEC there. And if you want more information, you can contact them through ACOExhibitHall.com. And just mention my book one more time. It's called Thriving in the Healthcare Market, Strategies from an Industry Insider for Selling Your Product. And what I do there is I identify 84 problems that I've seen trip up vendors trying to sell their products into the healthcare world, maybe because they don't understand the lay of the land, the rules of the road. So you can check the book out and pick it up if that's helpful to you. So thank you for your time today, and tune in for the next flash interview coming up soon. Thank you.